Erectile dysfunction, or ED, is a common condition that affects millions of men worldwide. It can be frustrating, embarrassing, and even distressing for those who experience it. But the truth is, ED is not just about sexual performance. It can also be a sign of underlying health issues that need attention. If you or someone you know is dealing with erectile dysfunction, understanding the causes, risk factors, and treatment options can make a big difference. In today's video, we'll break down what erectile dysfunction is, why it happens, and what can be done about it. Whether you're experiencing occasional difficulties or ongoing issues, there are ways to address it and regain confidence in your sexual health. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Erectile dysfunction is the inability to achieve or maintain an erection firm enough for sexual intercourse. While it's normal for men to occasionally have difficulty getting or keeping an erection, ED is diagnosed when this happens frequently and interferes with a person's sex life. Erections are a complex process involving the brain, nerves, hormones, blood vessels, and muscles. When a man becomes sexually aroused, signals from the brain trigger an increase in blood flow to the penis. This blood fills the erectile tissue, causing the penis to become firm. If something disrupts this process, whether it's a physical issue, a psychological factor, or a combination of both, it can result in erectile dysfunction. ED can happen in men of all ages, but it becomes more common as men get older. While age itself isn't a direct cause of ED, many of the health conditions that contribute to erectile dysfunction, such as high blood pressure, diabetes, and heart disease, tend to develop with age. The good news is that ED is often treatable, and in many cases improving overall health can lead to improvements in erectile function. There are many possible causes of erectile dysfunction, and they generally fall into two main categories: physical and psychological. Physical causes of ED are often related to blood flow, nerve function, or hormone levels. One of the most common causes is cardiovascular disease. Conditions like high blood pressure, atherosclerosis, or hardening of the arteries, and high cholesterol can restrict blood flow to the penis, making it difficult to get or maintain an erection. Diabetes is another cause of ED. High blood sugar levels can damage nerves and blood vessels, reducing sensitivity and blood flow in the penis. Many men with diabetes experience some degree of erectile dysfunction over time. Hormonal imbalances can also play a role. Low testosterone levels, a condition known as hypogonadism, can lead to reduced libido and erectile problems. Other hormonal disorders, such as thyroid imbalances or elevated prolactin levels, can contribute to ED as well. Neurological conditions that affect nerve function, such as multiple sclerosis, Parkinson's disease, and spinal cord injuries, can also lead to erectile dysfunction. Since erections rely on nerve signals from the brain and spinal cord, any disruption in this pathway can interfere with sexual function. Certain medications can also cause ED as a side effect. Drugs used to treat high blood pressure, depression, anxiety, and prostate conditions may affect blood flow, nerve function, or hormone levels, leading to erectile problems. In addition to these physical causes, psychological factors can contribute to erectile dysfunction. Stress, anxiety, and depression are major culprits. Performance anxiety in particular can create a cycle where worrying about getting an erection makes it even more difficult to achieve one. Relationship issues, past trauma, and mental health conditions can also play a role. For many men, ED is caused by a combination of physical and psychological factors. For example, someone with mild cardiovascular disease may experience occasional erectile issues, but anxiety about those difficulties can make the problem worse. Understanding the underlying cause is the first step in finding an effective treatment. Several risk factors increase the likelihood of developing erectile dysfunction. Some of these can be controlled, while others are unavoidable. One of the biggest risk factors is age. While ED is not an inevitable part of aging, the chances of experiencing it do increase as men get older. This is largely because of conditions like heart disease, diabetes, and high blood pressure become more common with age. Smoking is another major risk factor. Smoking damages blood vessels, reducing blood flow throughout the body, including to the penis. Men who smoke are at a significantly higher risk of developing erectile dysfunction compared to non-smokers. The good news is that quitting smoking can improve circulation and reduce ED symptoms over time. Excessive alcohol consumption can also contribute to ED. While a drink or two may help with relaxation, heavy or chronic alcohol use can interfere with nerve function, hormone levels, and blood flow. Alcohol can also contribute to liver disease, which can affect testosterone production and further worsen erectile problems. Obesity is another important risk factor. Being overweight, especially carrying excess fat around the abdomen, is linked to lower testosterone levels, increased inflammation, and poor circulation, all of which can contribute to ED. Losing weight through a healthy diet and exercise can improve erectile function in many cases. A sedentary lifestyle also increases the risk of ED. Regular physical activity improves cardiovascular health, reduces stress, and helps maintain healthy hormone levels. Men who are physically active tend to have better erectile function compared to those who are inactive. Chronic stress and mental health conditions such as depression and anxiety are also risk factors. The brain plays a crucial role in sexual arousal, and emotional well-being is closely tied to erectile function. Seeking support for mental health issues can often lead to improvements in ED symptoms. The good news is that erectile dysfunction is treatable in most cases. Treatment options vary depending on the underlying cause, and in many instances, a combination of approaches may be the most effective strategy. One of the first steps in managing ED is making lifestyle changes. For men with cardiovascular disease, diabetes, or obesity, improving overall health can lead to a better erectile function. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help support heart health and blood flow. Regular exercise, such as brisk walking, cycling, or strength training, can improve circulation and boost testosterone levels. If lifestyle changes alone aren't enough, medications may be recommended. The most common drugs to treat ED are phosphodiesterase type 5 inhibitors, including sildenafil or Viagra, tadalafil or Cialis, and vardenafil or Levitra. These medications work by increasing blood flow to the penis, making it easier to achieve and maintain an erection. They are generally safe, but may not be suitable for men with certain heart conditions or those taking nitrates. For men with low testosterone, hormone replacement therapy may be an option. This can involve testosterone injections, patches, or gels to restore normal hormone levels and improve sexual function. However, testosterone therapy is not suitable for all men, and it should be discussed with a healthcare provider. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, other treatments include vacuum erection devices, which use suction to draw blood into the penis, and penile injections that help stimulate an erection. In cases where other treatments have not been effective, surgical options such as penile implants may be considered. For men whose ED is linked to a psychological factor, counseling or sex therapy can be very helpful. Addressing anxiety, stress, or relationship issues can remove mental barriers to sexual function and improve confidence. Cognitive behavioral therapy and mindfulness techniques can also be beneficial. Erectile dysfunction is a common issue, but it doesn't have to be a permanent one. Understanding the causes, risk factors, and treatment options is the first step toward finding a solution that works for you. Whether the issue is physical, psychological, or a combination of both, there are many ways to improve erectile function and restore confidence in your sex life. If you're experiencing ED, don't hesitate to talk to a healthcare professional. Addressing the problem early can not only improve your sexual health, but also uncover any underlying medical conditions that need attention. Thank you for watching. As always, take care of yourself and make the most of your day.